Good morning. 51 was negative. Other presentations of syphilitic retinal vasculitis can include ground glass appearance of the retina, acute syphilitic posterior placoid chorioretinitis. The limitations of this the report was like a second retesting was not done, like FT antibodies was not done because specific test was positive. And we asked for a lumbar tap, which was advised against. Take-home messages, miliary retinal lesions seem to involve full thickness of the retina, which is a characteristic of ocular syphilis. Delayed presentation and diagnosis of the disease is another factor which contributes to the poor visual acuity. Syphilis should be ruled out and should be tested for an infectious panel of investigations. Ocular manifestations of syphilis can cause gross visual impairment. It can mimic other diseases of the eye. Hence, syphilis should be ruled out, even though if medical history does not initially raise suspicion. Thank you, sir.
So, Dr. Shri Kirti, in your patient you have done RPR and TPHA.
Yes, sir.
And your RPR was negative and TPHA was positive.
Yes, sir. But treponemal tests were positive, sir.
Yeah.
The non-treponemal tests were not.
That was negative.
Yes, sir.
So that TPHA can be false positive.
Yes, sir.
There are conditions where that TPHA can be false positive, particularly in the patients of biliary cirrhosis and other things. And if that ocular syphilis is there, it is considered as a neurosyphilis.
Yes, sir. That's why we had asked for a CSF, but CSF analysis, but it was advised against, sir. We wanted to rule out neurosyphilis also because secondary, whenever syphilis presents in these elderly females, we suspect it is usually linked to neurosyphilis only. And we had asked for, but the doctor had advised against. No need, he said.
And any other systemic clinical feature?
Systemic lymphadenopathy was ruled out, sir.
The Trendelenburg test?
Sir?
Trendelenburg test.
The gate.
Yeah.
Probably we.
And that ANA was also positive.
AN also was positive,
SLE,
sir.
SLE is one
SLE
false positive one.
could be a false positive, sir.
Because that collagen tissue disorders, in those patients you can have a false positive TPHA.
Yes, sir. Yes, sir. We thought so, sir. But what happened was when we got the second testing done, there was a reduction in titers, sir. 1:1280 came down to 1:320. So there's almost 3/4 of the reduction of titers in literature, which suggests that it is if it responds, if syphilis responds to our treatment, there will be a reduction in titers, sir.
And the main thing that RPR was negative. So if
RPR
it was
was
positive, then we can consider that okay, RPR is positive, TPHA is positive. It may be the recurrence of latent syphilis.
Latent
but that
syphilis.
RPR was negative.
Yes, sir. That was only.
And once that syphilis is there, that TPHA once positive is always positive for the lifelong.
Yes, sir. So, but she came back with a recurrence, so we thought it had reactivated.
Okay.
Okay.
Thank you.
Thank you so much.